Thank you, Mr. Chair. My next bill, AB 941, exempts tribal health clinics located off Indian lands from the Department of Public Health's state facility license.
Second.
The bill only addresses the exemption of clinics from DPH's facility licensing while still complying with other state laws such as Cal OSHA, California Fire Code, Building Code standards, seismic safety standards, patient and employee safety compliance law, and many other requirements. Indian health clinics are licensed under the federal government and Indian Health Service licensing process and are well known to have a concise and comprehensive licensing process already in place. The state facility licensing process is open to a tribal clinic and on non-Indian land is duplicative, time-consuming, and costly. As the committee's analysis points out, there are minor cost reductions of about $700 per facility in licensing to DPH. The staff time and resources used in a duplicative application with the state could be better spent on providing additional patient health care needs. I'm also continuing to work with the opposition to address their concerns. Here to testify if there are any questions is Mark LeBeau, the Executive Director of the California Rural Indian Health Board.
Thank you so much. Witness in support.
Good morning, Chair Gomez, Vice Chair Bigelow, and committee members. Thank you for allowing me to testify about the importance of Assemblymember Wood's legislation, AB 941. The California Rural Indian Health Board that I work for is a nonprofit and federal tribal organization that represents about 30 federal tribal governments and their tribal clinics in California. Today, on behalf of the California Rural Indian Health Board, I request the committee support AB 941. The California Primary Care Association, which represents more than 1,000 clinics throughout the state, the Latino Coalition for a Healthy California, the California Pan-Ethnic Health Network, and multiple tribes and tribal clinics also request your support. AB 941 would create a much-needed single standard for clinic licensure for federal tribal clinics in California. Tribal clinics may only provide health care within their federally defined service areas, which are primarily in rural, mountainous, and frontier regions. Today, tribal clinics exist to serve American Indians, Alaska Native patients, and under federal rules, they may also serve other populations. Currently, tribal clinics located on Indian land are exempt from state licensure. This works well because all tribal clinics must adhere to a comprehensive list of federal standards that ensure the quality of care and the safety of patients, facilities, and workers. What doesn't work well is requiring tribal clinics to comply with duplicative and redundant standards. If a tribal clinic is located off Indian land, state licensing requirements apply, despite the fact that the federal standards address the same issue as the state standards. These multiple clinic licensing standards create undue administrative challenges and burden for tribal clinics. The burden interferes with the core mission of tribal clinics, which is providing federal health care services to tribal communities and elevating the health status of American Indians, Alaska Natives. In light of these facts, again, I respectfully request the committee's support of AB 941. Thank you.
Thank you so much. Any other witnesses in support? Individuals from the public in support?
Hi, my name is Christine, and I just wanted to note a couple other supporters of the bill, including Big Valley Band of Pomo Indians, Blue Lake Rancheria, Chapatee Indian Health Program, Cloverdale Rancheria, Greenville Rancheria, Karuk Tribe, Kashaya Band of Pomo Indians, Northern Valley Indian Health, Pitt River Tribe, Rosagini Rancheria, Riverside San Bernardino County Indian Health System, Smith River Rancheria, Toyabe Indian Health Project, Tule River Indian Health Center, United Indian Health Services, Warner Mountain Indian Health Clinic, and the Yurok Tribe. Thank you.
Thank you so much. Any witnesses in opposition? Any individuals from the public in opposition? Department of Finance?
No file, Mr. Chair.
No file. Questions or comments from the committee members? Mr. Gallagher?
So I have a few questions and concerns. I guess the first would be, I understand when the clinic is located on tribal land, because of sovereignty issues, that they aren't subject to the State Department of Public Health. But that kind of goes away when that clinic is not on tribal land anymore. So why should they be exempt when they're not on tribal land anymore and they are technically under the jurisdiction of the state of California?
They're going to comply with all all laws and throughout the state. They're
except the Department of Public Health licensure.
No, they'll still comply with the Department of Public Health regulations, but they won't go through the licensure procedure, which is duplicative and redundant, quite frankly.
Now, do these clinics only serve the tribal members of that, I guess, of that tribe, or do they also serve the general public in California?
In many areas, they serve the general public. That's correct.
Well, so then that's my other concern. If they're serving the general public of California, shouldn't we have... I mean, I think there's a lot of cases here in California where we don't say, hey, what the federal government says is good enough. This is California. We want to ensure that, that the clinics are meeting our requirements, our standards for service to the general public. So, again, in that case, isn't there a reason to have DPH license those facilities?
I guess if you conform to the idea that we should have redundant, duplicative requirements, I guess that would be correct. But they are complying with essentially the exact same requirements that they do through Indian Health, and through the federal government. So it's just duplicative, and from our opinion. So.
Okay. Thank you so much. The witness, please.
Great questions, Assembly Member. Tribal clinics that provide services to American Indians and Alaska Natives in their service area and other Californians. They provide Medi-Cal services, managed care services, so they're required to make sure that state quality care measures, patient protection through the state is abided by. In addition, there's currently over 15 exemptions already on the books for various types of clinics in California, including county clinics, city clinics, county hospitals, and in fact, if a tribal clinic is off tribal lands and is lucky enough to have a partnership with an institution of higher learning like UC Davis, for example, where they bring in a doctor to work for a tribal clinic off tribal lands, then they have an exemption as well. So this is essentially streamlining that process already, making it easier for the tribal clinics to provide care. They do comply with all federal and state rules. The only issue is just the request to streamline the licensing process on the federal side. Right now, tribal clinics have to adhere to all federal licensing standards, and then the clinic administrators have to turn around and comply with all state licensing standards as well. So it's two packages of work, quite a bit of a burden on an underfunded tribal clinic in California.
Thank you so much. I want to remind everyone that this is a fiscal committee. We're going to try to stay focused on the fiscal issues as much as possible. And just because we voted out of this committee doesn't mean that the members do not reserve the right to vote against it on the floor. But I appreciate the presenting the bill and bringing it forward. And I have no doubt that the policy committee did a fabulous job in reviewing the policy. So we have a motion and a second, and this bill is out on an A roll call with Gallagher not voting. Thank you so much, Mr. Wood.
Thank you very much.
Mr. Levine, you're up. Mr. Levine, you have two bills on consent and one with the due pass recommendation. How would you like to proceed?
I will begin with with AB 498. Thank you, Mr. Chair and members. AB 498 furthers state policy to protect wildlife corridors by encouraging voluntary actions to preserve wildlife corridors and allows conservation banks to be used to maximize habitat linkages. The analysis indicates that there will be no direct state cost as a result of the bill. If the bill moves forward, I'm committed to work with the opposition and hope to further clarify that these actions are voluntary and that the bill does not modify CEQA requirements. I respectfully request an aye vote today.
Move the bill.
We have a motion and a second. Witnesses in support.
Good morning, Chair and members. Katrina Robinson on behalf of Audubon, California and the Land Trust of Santa Cruz County. Just to make some quick comments, climate change is threatening wildlife and biodiversity in California. Audubon's models show that 314 bird species alone are threatened and in danger of losing up to 50% of their habitat. By creating a statewide policy that promotes habitat connectivity and wildlife corridors where the state already requires mitigation, we can protect and preserve the highest quality habitat and allow wildlife to move between this habitat instead of ending up on our roads or in our backyards. I respectfully ask for an aye vote.
Thank you so much. Any other witnesses in support? individuals from the public in support?
Hello, this is Jeff Volberg with California Waterfowl Association in support of the bill.
Thank you so much. Any other individuals in support? Witnesses in opposition, come forward, please.
Mr. Chairman, committee member Silvio Ferrari with the California Building Industry Association. Unfortunately, still in opposition to the bill today, but we have greatly appreciated the time the author, his staff, has spent with us to try to alleviate our concerns. We've addressed a number of them, but have a long ways to go. Fundamentally, I think what we're still kind of have a lot of angst about right now is what this consultation process is going to look like, when it starts, when it stops, who's involved, how many people are involved, and what that means for a project applicant that might come forward. So, but we do look forward to working these out as the bill gets to the floor. Thank you.
Thank you so
Valerie
much.
Nera for the California Chamber of Commerce, also in support, but ever hopeful.
Thank you. You mean opposition or support? Okay, we'll take it as support. Individuals from the public in opposition? Department of Finance?
No file, Mr. Chair.
No file. Question or comments from the committee members? Okay, seeing none, Mr. Levine, would you like to close?
I respectfully ask for an aye vote.
We have a motion and a second, and it's due pass recommendation out on a B roll call. Thank you so much. Ms. Irwin, you're up. Ms. Irwin, I take it that you're presenting on your suspense item, correct?
I'll be presenting on 770.
Correct.
All right.
That item is already on suspense, but move forward and please present.
All right. Thank you, Chair Gomez and committee members. AB 770 addresses a long-standing challenge to higher education and student success. Over 70% of our students entering community college are deemed unprepared for college-level work and are in need of remediation. These students must take multiple classes in order to begin college-level courses toward a degree. In many community college districts, including my district, less than 1/3 of the students who start in basic skills math or English ever complete a college-level course. These numbers show that existing remedial offerings are failing our students and discouraging them from the pursuit of their goals. Efforts in California have demonstrated the success of innovative ways to deliver English and mathematics remediation. In these pilot efforts, student completion rates for college-level English courses more than double and are more than 4 times better for college-level math. Unfortunately, less than 1/3 of community colleges offer such new approaches, and if they do, they are limited to 1 or 2 course sections that are not available to most students. AB 770 targets this lack of access by providing a financial incentive to community college districts to redesign their basic skills offerings. This bill outlines a proven model of success that will lead to substantial cost savings by replacing less efficient models of basic skills courses and streamlining a student's path to completion. I have with me here today in support Jesse Ryan, Executive President of the Campaign for College Opportunity, and Rona Sheriff, Co-Director of the California EDGE Coalition.
Thank you.
Thank you.
Assemblymember Gomez, I'll be brief. The Campaign for College Opportunity believes that improving remedial education delivery is the single greatest lever to improving student success. We know that the longer a student spends in a lengthy remedial education sequence, the less likely they are to recover and actually achieve a credential, certificate, degree, or transfer. This is incredibly costly to both students and the state. These high-impact practices that we're asking to take to scale across the state have been shown to yield an improvement of more than 200% for students who've undertaken the English sequence. For math sequence, a more than 400% improvement, which is incredibly dramatic. And what we've projected is that if we can shave just a single remedial education course off the traditional sequence, we'll save $100 million annually for the state, which is very good for the state, but also good for students in helping them reach their college goals. We ask you to support this bill and help eliminate the exit points on the path to student success and help us improve college completion.
Good morning. I'm Rona Sheriff. I'm with the California EDGE Coalition, which is a coalition of business, labor, and social justice organizations, and we are focused on meeting the skills gap in the workforce. We think basic skills is the major barrier to doing that. We are proud to be a co-sponsor of this bill, and we feel this bill will have huge payoffs to students. They'll get through the programs more quickly and into the workforce, payoffs to colleges because there'll be seat time savings as they can redirect into other programming, and payoffs to the economy at large. And we urge your aye vote.
Thank you so much. Any other witnesses in support? Individuals from the public in support? Witnesses in opposition? Individuals from the public in opposition? Department of Finance?
No file, Mr. Chair.
No file. Question or comments from the committee members? Seeing none. Mr. Irwin, thank you so much for presenting this bill. As a community college student myself, I had to start off with some basic classes, but it did build a foundation to help me fulfill my higher education goals and also with a master's degree. So I know this is an important bill to everyone, and we'll take a hard look at it in due course when it's on the suspense file. Thank you so much.
Thank you, Assemblymember Gomez.
Mr. Mays. You have one bill with a due pass recommendation.
Mr. Chair, members of the committee, I'm happy to present AB 1123. This bill allows counties that participate in the dispute resolution programs of 1986 to transfer the program's duties and responsibilities to the court, and provides that future state funding will go directly to the court. The transfer is not required, but it is merely authorized. According to the Appropriations Committee analysis, any costs would be minor and absorbable. I'll close by noting that we received some policy concerns yesterday, and I have a great respect for the member who brought them to my attention. I look forward to exploring ways to alleviate them, including possible amendments. Thank you for the consideration.
Thank you so much. Witnesses in support?
Good morning. Anthony Newman on behalf of the sponsor, the County of San Bernardino, in support.
Thank you so much. Other witnesses in support?
Thank you, Mr. Chairman and members of the committee. I'm sorry, we're in opposition.
Oh, okay. Witnesses in just a second. Individuals from the public in support? Witnesses in opposition now.
Thank you.
Thank
Mr.
you.
Chairman and members of the committee. We are here as members of the Legislation Committee of the Bay Area Coalition for Community Mediation to express our concerns about this bill and its potential impact on community mediation programs. We did send a letter around to all of the members of the committee stating our basic concern. I would like to point out that the courts, in their struggle to survive the very difficult economic times, have reached out and glommed onto any sort of funding source that they can obtain. That would include, for example, small claims legal advisors programs, which have been largely absorbed into the court's staff, family law facilitators that have been folded into their self-help centers and so forth. And we are very concerned that by giving the courts the call on who gets funded with DERPA funds, that there's just too strong a temptation to divert it into court-based programs. And that would kill the whole purpose of DERPA, which is to foster community mediation. The programs that have been funded so far in communities have been extremely innovative and have been very helpful to bringing all kinds of resources. For example, in the county where I worked, in Alameda County, the community mediation programs there consolidated in order to survive, but they also have grown and extended themselves into the schools with restorative justice programs and those sorts of things. Go ahead.
Thank you for this opportunity. My name is Barbara Proctor, and I'm a program director of a community mediation center in Contra Costa, and I also am a board member of CDRC, which is a nonprofit group but it does offer advice to all the ADR legislation that comes through. You might know those initials. We opposed 1123, and I would like to say that there is a great negative financial impact to the state and courts if this measure is passed. As one example, in our small program, and we have 1.5 full-time equivalents, 2,000 volunteer hours are donated each year by volunteers. We can cost their services out, according to DERPA, at a very low cost of $25. And that's $50,000. We do that in order to have a matching amount with the DERPA requirements. In addition, our overhead is extremely low, and the volunteer hours are substantial. If this were costed out at a non-volunteer mediator, which is more like $100 to $200 an hour, it would come out to $200,000. So some way somebody's going to have to absorb that cost. As you can see, the savings is substantial at $150,000. Now, these figures are from my small center, and you have to multiply it about 40 centers in the state. That's quite a significant amount. The courts would have to somehow absorb that, and we know their overhead is quite substantial as compared to community mediation centers.
Ma'am, thank you so much. I greatly appreciate your testimony and your background on this. I want to move this along. Any other individuals from the public in opposition? Any Department of Finance?
No file, Mr. Chair.
No file. Question or comments from the committee members? Mr. Bloom.
Thank you, Mr. Chair. I received a letter yesterday, as I assume members of the committee did, from Mary Colbert at Loyola Law School, expressing many of the same concerns that the opponents have here this morning. It's a lengthy letter. I only got it yesterday. I can say this as a former mediator in the court system in Los Angeles County, the mediation program there, and I presume by extension across the state of California, were not particularly well funded in the best of times, particularly given the important function that they provide within the judicial system and within our communities. The courts are indeed faced with a crisis. I sit on the Judicial Council and hear about it all the time, and from, of course, members of the bar, member of our communities. I'm not convinced that this is or this isn't going to make it easier for the court facilities to take these funds and apply them to different purposes. But I am sufficiently concerned that might be the ultimate impact. I'm going to stay off the bill today. I'll be looking at it much more closely as it moves forward.
Thank you. Mr. Gallagher?
Well, my understanding of this bill is that it's really voluntary, right? There's no requirement that the county transfer over its program to the court. It's only if they agree to do so. So, that's correct. By passing this legislation, we're not necessarily incurring, all the courts are not incurring this cost. It's only if the county and the court agree to do so. Is that correct?
It's completely voluntary, and the county can decide to transfer this to the courts or not.
Okay.
At the currently, they can do that.
Hold on.
Sorry.
One at a time. I see that the witness in support wants to make a comment, make a brief, or
yes, sir. Thank you. No, and I just wanted to point out that we too received the opposition letter yesterday, the lengthy one, and we have since reached out to the opposition and have agreed to work as this moves forward. It's a complicated issue. There's potential speculation in the letter, so we want to properly vet it and work with the opposition to resolve all concerns.
Thank you so much. I want to make just a general comment. We do have a legislative process where we go through policy committees, fiscal committees, and then we go to the floor of one house and then goes over to the other house. And that's the reason, is to make sure that these bills are are vetted thoroughly. I believe that individuals within members that are just are becoming aware of this issue are starting to raise concerns. I have a due pass recommendation on this bill, and I want to make sure that we move the bill forward. But I think that unless you resolve some of these concerns, you're going to be facing more and more opposition as it moves forward. So I want to make sure that you understand that I think the opposition is real, and it's something that you should take serious consideration when moving the bill forward and hopefully amending as you move forward. I need a motion on this bill. It's been moved by Bigelow and Chang. This bill is out on an A roll call with Bloom not voting. Thank you so much.
Yep, thank you. Thank you so much.
Mr. Mathis, you're up. Mr. Mathis, you have two bills, AB 75, it's on the suspense calendar, and then AB 144 with a due pass recommendation. What's your pleasure? Excuse me, it's actually on consent. My notes say due pass, but either way it gets out.
We can put them both on consent.
Your other one's already on suspense, so we can't do that. But please go ahead and begin.
Okay. Good morning, Mr. Chair and members. Today I'm here to present AB 75, a bill that will permanently fund 36 claim representatives in the Calvet Service Division. Calvet currently faces significant challenges with retaining these highly skilled employees because of the current limited term status of these 36 positions. As of March 27th of this year, these strike teams in San Diego, Los Angeles, and Oakland have reviewed 50,894 claims, resulting in over $56 million in retroactive payments to our veterans. While these employees have done remarkable work, their mission is not yet complete. Currently, these positions are due to expire next year. But for practical reasons, these highly skilled people are already looking for other opportunities. Rather than waiting to the last minute to extend a program that we know needs to be extended, let's give these people the certainty they deserve, our veterans the services they deserve, and save the state the trouble and the cost of having to rehire, retrain, or replace what is already working. By keeping the strike teams, we will keep the promises to our veterans who have served our country with honor, that the benefits which we promise to them will in fact be delivered. This bill has no formal opposition, and I welcome the committee's questions and comments.
Thank you so much, Mr. Mathis. Any witnesses in support? Individuals from the public in support? Witnesses in opposition? Individuals from the public in opposition? Department of Finance?
No file, Mr. Chair.
No file. Questions or comments from the committee members? Thank you, Mr. Mathis. Thank you first. Let me thank you for your service to our country and during your military service, and also your continued service to the veterans of this country. It's definitely a worthwhile bill. We'll take it into due consideration when it's on the suspense file. Thank you so much.
Thank you.
Would you like to any last comments?
Just I want to let you guys know I'm definitely willing to continue to work with the committee on any concerns moving this forward, and I just want to make sure that we continue to take care of our veterans.
Thank you so much.
Thank you.